Good day to everyone joining us here today, and Ramadan Mubarak to those who celebrate. I'm delighted to welcome everyone to a very important conversation today on COVID-19 and the challenge of reaching a humanitarian ceasefire in Afghanistan. My name is Marika Theros, and I'm a senior fellow at the South Asia Center at the Atlantic Council. We're very pleased to be able to host this discussion with a group of very dedicated leaders who will provide us with their perspective on the prospects of a humanitarian ceasefire in Afghanistan, what shape it might take, what role the international community can play in creating the conditions for it, and as well as the ramifications of not reaching a ceasefire during the pandemic. I also want to remind those in the audience that they can leave questions in the comment sections throughout the panel, but please do identify yourself and your organization when you submit your question. About a month ago, the UN Secretary General called for a global ceasefire in conflict-affected countries in order to be able to tackle what he called our common enemy, COVID-19. Since then, fighters in a number of countries have expressed their readiness to accept the call. In Afghanistan, there's also been a growing number of voices backing the call for a ceasefire, including by the EU, the Organization of Islamic States, Afghan civil society, and many others. Over the last few weeks, for those of us who follow Afghan politics, we've heard a lot about how COVID pandemic complicates the country's peace process, with some suggesting it could even create a potential opportunity to build confidence between the different parties. And indeed, COVID has created new challenges for the peace process, the least of which are logistical. And we see increasing pressure being put on all parties to get to the table. Yet this assumes the luxury of time, which COVID doesn't provide. The virus will not wait for a peace process before it spreads. And on the flip side, a quick deal prompted by the challenge presented by COVID cannot lead to sustainable peace either. So in today's discussion, I'd like to really have the panelists focus our attention on one of the greatest challenges that Afghanistan will ever face, which is this pandemic, a challenge that has put pressure on world-class health systems in rich countries across the world. And in Afghanistan, this is a country that is marked by an underdeveloped and weak health system in the best of times, a very vulnerable population with multiple health challenges, and increasingly political and armed actors who seek to exploit the COVID pandemic and or use violence as a way to bolster their leverage at the negotiation table. It appears that there seems to be an urgent need to depoliticize the challenge of COVID. If current projections of infection and death rates are correct, Afghanistan is likely to see more civilians killed by the virus than the last 19 years of conflict. Therefore, I think it's incredibly important to hear from our panelists today, to provide an overview of the current state of play, to examine the various challenges that are impeding the response to COVID, and to explore possible pathways in creating a more joined up effort in addressing it. So without further ado, let me introduce the panelists. Today we have Ambassador Roland Kobia with us. Thank you, Ambassador. He is the EU Special Envoy to Afghanistan. Prior to Afghanistan, he also held the posts of Ambassador in Myanmar and also in Azerbaijan. He has also served as Deputy Head of Mission in the DRC and Head of Regional Political Affairs in Kenya. We also have with us Andrew Watkins, the Senior Analyst for Afghanistan for the Crisis Group, where he focuses on the peace process. However, he's had a lot of experience in Afghanistan. Before joining Crisis Group, he worked as the Political Affairs Officer at UNAMA and also as an independent researcher, and has spent considerable years working in or on Afghanistan. We also have with us today Dr. Orzala Nemat. She is an internationally known Afghan activist, scholar, and expert in political ethnography. She's also the director of the Afghanistan Research and Evaluation Unit, a global-based independent think tank that was recently, I believe, awarded Best Think Tank in the South Asia region. Congratulations. Sahar Halaimzai, who I'd like to also give a special thanks for initiating and organizing this event. She's a writer, activist, and human rights campaigner for the last decade, and she's previously worked on issues like Uyghur rights in China, freedom of expression, and the rights of journalists in the most difficult environments. Recently, in early 2019, she co-founded the peace campaign called Time for Real Peace, which aims to elevate the voice of Afghan citizens and others marginalized into the debate decisions that will ultimately affect lives. But let's turn to our first panelist, Andrew Watkins, to help kick off the discussion and to give us an overview of the situation on the ground. It'd be great to highlight some of the challenges that are impeding progress, including just the state of play on the peace process, the political gridlock, and other factors. Thank you.
Absolutely. Thank you so much, Marika, for the introduction, and to Sahar as well for helping organize and put this together, and to the other participants. It's great to be with you today remotely. I think one of the most important things to acknowledge, as Marika touched on briefly, about the difficulties the peace process faces due to COVID-19 is that it already faced a number of challenges early on. Indeed, just hours after the signing ceremony of the agreement between the United States and the Taliban on 29 February, issues began to pop up. Not issues or challenges confined to one party of the conflict, but across the board, there were several difficulties that popped up, and some of these were foreseen. Some seem to have become greater difficulties or problems than had been anticipated. One that came up very quickly was the Taliban almost immediately resumed violent activity across the country. We've since been able to study the Taliban's activity over the last 6 weeks or so. And while it's uneven across the country, and we're still not quite sure what to make of this, the group's intensity of fighting is growing, very similar in a lot of ways to the way that it would in a traditional spring offensive, when the group's fighting and when the country's conflict reaches its highest point in the warmer months of spring and summer. So this began, again, almost immediately after the group signed a deal that many thought would carry some hope for peace to move forward without much delay. Another issue was the question of prisoner exchange. The commitment that the United States signed and shared with the Afghan government, the language that it used was very different than the language included in the US Taliban agreement. And the US Taliban agreement included terms and conditions that called for the Afghan government to release prisoners, 5,000 of them, in fact, compared to 1,000 prisoners that the Taliban were supposed to release in exchange. Of course, this is a huge demand for the Afghan government, even under different circumstances, because the Afghan government was not included in these talks with the Taliban, and it was not a signatory to this agreement. And there's an understandable amount of concern. The impact of COVID-19 on prisons around the world, and experts who talk about detention and prison conditions, makes the question of prisoner exchange all the more urgent. But this was already one of the earliest issues to pop up. Several other issues have impeded the peace process that don't have to do with a difference of opinion between the Taliban and the Afghan government. One is simply the political drama that has played out in Kabul between various political leaders and figures who support and have engaged with the Afghan government. It was only after the US Secretary of State, Mike Pompeo, visited Kabul on 23 March and laid out a series of what were reportedly very stern words for both President Ashraf Ghani and Dr. Abdullah, that was followed by a threat to cut $1 billion in US aid, with the potential for more cuts in the future. Only after these threats of cutting financing did we see rapid movement on the Afghan government's part and other Afghan politicians to declare and support an Afghan negotiating team. What was initially hoped to be a starting date for intra-Afghan negotiations, talks between the Afghan representatives and the Taliban itself, was March 10th. But it wasn't until the end of March that the Afghan government even announced a team that had buy-in and acceptance from other Afghan political figures. So we really had a mountain of challenges from every different angle and from every different party to the conflict that came up before COVID-19 approached. I think, as Marika noted, what we're facing now is the urgency, the need, the humanitarian need to respond and to tackle those issues and crises, which didn't start with this pandemic, but the pandemic makes all the more important to address. I think I'd like to turn it over to our other panelists on that note.
Thank you, Andrew. That was really helpful to great overview of the lay of the land, especially as you note, there are a number of challenges that the peace process faced prior to the pandemic. I would like to now turn to Ambassador Kobia. Is he on? Yes.
Thank you very much. And hello to everybody. And first of all, I would like to wish a Ramadan Kareem to all our Muslim listeners, and notably to Afghans. I really hope you will have a nice month in spite of the circumstances with your families and all your friends. So a few minutes of introduction. I think at the outset, what we need to say is, to us, the COVID-19 is a game changer. There certainly cannot be business as usual, and nobody can pretend that things are like they were before the COVID. I'm saying this because all the parties need to understand that the book has changed, or at least the context of the book has changed, and that we need to move to another chapter. As Andrew was saying, Doha was signed, but that was another world at that time, or it was the beginning of a new world. And the Taliban, notably, but all political actors need to understand that I think the enemy is no longer the visible and traditional enemy they had, either the government for the Taliban or the Taliban for the government, but that there's a new enemy which is new and invisible across the whole country and across the region and across the world. So to defeat that enemy, there needs to be a paradigm change where Afghans will need to look at things differently and probably to try to fight together instead of fighting against each other. So, I mean, needless to say that this crisis is unprecedented, at least in modern times, and that all the parties need to show the statesmanship and in a way, the political reason to try to tackle this pandemic. It will have a lot of impact on population, on the politics, on the economy of Afghanistan. It has already impacted the peace effort. Andrew was referring to this. What I think is important for all leaders is to know already today that people will not forget what is happening today and how their leaders, either in the government controlled or in the government or in the non-government controlled areas, how the leaders have actually cared for the health and well-being of Afghans. So those who have ambitions for the future, I think, should quickly understand that. And now is the time to win the hearts and minds of Afghans. Tomorrow will be a bit late. So I'm a bit surprised to see that the COVID is in a way considered as important for a number of things, like the prisoners' release, but it's not considered important enough for the ceasefire. The prisoner release is about 5,000 people, and the COVID and the ceasefire is about 35 million people. So I'm not saying that taking care of prisoners is not important. It is, but one should look at the figures. And I see that the COVID is taken as a reason why the prisoner should be released, and not as a reason why there should be a ceasefire. So there's a logic there. I think we need to discuss. So as you know, the EU has been, I think, very loud and very clear in supporting the humanitarian ceasefire that has been called by the UN. But more than that, that is being called by the Afghans. I think we should not forget that, first of all, it is the Afghans calling for a ceasefire before the internationals, and more importantly, in a way, than the internationals. And when I get sometimes calls to the EU to try to intervene in all regions of Afghanistan, notably Taliban-controlled areas, which we try to do because humanitarian aid is needs-based. It doesn't discriminate on the basis of the people, the religion, the ethnic group, etc. But it is also true that it's very difficult to access non-government controlled areas with humanitarian aid because of the security, because of the lack of access, because of the taxes that are imposed upon partners, etc. So I think that if one calls for humanitarian aid, it should go together with the humanitarian ceasefire. That would make things much, much easier. I'm very happy to see that a number of countries, you mentioned at the beginning, the EU and the UN, but there's a much wider constituency that has been supporting the humanitarian ceasefire. Many, many dozens of countries have supported this, and even countries in the region like Iran, like some countries in Central Asia. So I think there's a real momentum there, which is building up. It would be, even the US now is becoming, I think, much more vocal in supporting the ceasefire besides the reduction of violence, and I welcome that very much. I think what would be very important is to have all the neighbors of Afghanistan calling for the ceasefire. And I would like to hear notably countries like Pakistan, what they have to say about this, because it is very important that the neighbors contribute to this positive momentum. Let me just note that, I also hear that sometimes the Taliban have the impression we call for a ceasefire only in Afghanistan. This is not the case. This is a global call, and this call has been answered already in many different locations around the world, both by governments. I recall that Saudi Arabia has accepted a ceasefire in Yemen, but also some insurgent groups that have accepted a ceasefire in their own region, and notably some Islamist group like the Patani Malay National Revolutionary Front, which is an Islamist group in Thailand. So I think these groups have listened to the call of their people and have accepted a ceasefire. So I think Afghanistan should actually be next. So concretely on the COVID, you have seen that the EU has proposed a package of about $130 million, 117 million euros. This includes fresh money, quite a lot of fresh money. So it's not only redirected money. And this, I hope, should help, an ailing healthcare system to try to cater for this pandemic in Afghanistan. Now, a few words on the second point you asked me to talk about, that is the peace process. I think on the peace process, it's very clear also that, just like the previous point, that the clock is ticking and that there's an increasing sense of urgency on the political and peace process front. No effort should be spared, to support the current opening that Doha has created, but not only Doha. I want to highlight this. Doha was one step in a very long process. It was an important step. It was a necessary step, probably, but it's not the full and final story of peace in Afghanistan. I think there should be a wider, more balanced, more proportional way to look at the peace process. Because when you look at things 2 months now after the signature of the agreement, hopes have not materialized yet. The progress on the peace process has been slow. It has been disappointing, and COVID has come in the way, but not only COVID. What I feel is that all parties should do better. But when I look at the Taliban, I see very little appetite for compromise. I see very little signals on a real commitment to a peace spirit beyond the strict letter of the agreement. There seems to be a very exegetic interpretation of the agreement, which is fine for a lawyer, but when you look at things in political terms, you should look at the spirit of the agreement as well, which is as important, if not more. So I think it is time to show the willingness to engage in peace with concrete actions that go beyond letters. The political gridlock has been referred to by Andrew. I think it doesn't help either in Kabul, and each day that passes, I think without a consolidated government, a united team, exposes not only the Afghan population to greater dangers, but it also undermines the credibility of the Republican constitution and of democratic institutions. So I think this may have a much longer term aspect than simply putting a team together. So the next step for us is to start the intra-Afghan negotiations without any delay. The agreement, if you look at a strict interpretation of the Doha agreement, it says that up to 5,000 prisoners should be released. Well, then, I think about 400 prisoners now have been released by the government. Is that not good enough to actually, slowly moving into the start of the intra-Afghan negotiations? The agreement doesn't say that 5,000 until the last one should be released. This is not what it says. So as far as we are concerned, we are trying to help the implementation of this agreement. We remain committed. I think our position has tried to be imperfectly. We are not perfect, just like anybody else, but we have tried to remain predictable, stable, principled. We tend to avoid changing direction with dominant winds. But at the end of the day, it's for Afghans themselves, in the intra-Afghan negotiations to decide on their future. What we are also trying to do within these negotiations is to preserve the republic, to preserve a constitutional order. I'm saying a and not the constitutional order, because constitution may change. That is for Afghans to decide. We also want the political, economic, and social achievements since 2001 to be not only preserved, but to also be continued. And this is what we are, trying to do privately and publicly, but with consistency. And I think now is really the time for all political leaders on both sides to live up to their responsibilities. Because as I was saying at the beginning, and I will close the circle with this, I think the Afghans will remember what happened during the COVID crisis. And what can be said after the COVID crisis has ended will probably not be enough to win their hearts and minds. Thank you.
Thank you, Ambassador. And thank you. Just picking up on the point before I turn to Orzala about how COVID is a game changer and we're in a new environment, which requires us to think a little bit differently, both in terms of how we approach the pandemic, but also how we approach the peace process and the interrelationship between the two. So I was hoping, Orzala, if you don't mind, if you can paint us a little bit of a picture of what's happening with COVID, both in terms of the infections, how it's being managed, the challenges in managing, and what would a ceasefire do in improving the response to COVID, and what might happen if there is no ceasefire, in terms of the impact on the Afghan people. Thank you.
Thank you very much, Marika. Good day to everyone. Ramazan al-Mubarak to all those who are fasting. Following the conversation by earlier panelists, what I would like to say in terms of the real picture on the ground, unfortunately, like in every other place on the planet, this is something that does not distinguish between countries in conflict or countries in peace. So in Afghanistan, sadly, there is also a spike in the making, as we say. So until yesterday, the data that I saw, by the way, I'm in California now, so the yesterday for me is earlier today in Afghanistan. It was 1,330 confirmed cases, 95 new cases were reported until yesterday, and 43 deaths, 188 recoveries. Only later today, we got 172 cases confirmed, around 7 deaths and 13 recovered. So the numbers in terms of COVID-19, unfortunately, is increasing, and it's increasing at a worrying level. And I just would definitely come back to what is happening in terms of the COVID-19 situation and responses. But before that, I should also say, following the conversations by panelists, that unfortunately Afghanistan is one country that, besides the COVID-19 concern in everyone's mind, we are being killed, we are being attacked constantly without any major or significant changes. The first quarterly report of civilian casualties by UN was published, and according to this, there is only a 29% decrease in comparison to last year. By the way, last year was unprecedented in terms of casualties we had due to war. So 500 deaths from the beginning of the year. Unfortunately, 150 among them are children. The major victims of this war are unfortunately children. And out of these 500 deaths, 39% by Daesh, 13% by 39% by Taliban, and 13% by so-called Daesh. The distinction between the two are also problematic, but probably we just, count here the price of this war to ordinary Afghans. Following the U.S. peace deal signing, unfortunately, we've seen a spike again on the attacks. We all remember in Afghanistan that the week before signing of the agreement, because of the conditions between the Taliban and the Americans, the Afghans and the Afghan government has been completely, absent in this process, was that there was a prisoner release agreement at that time. So the RIV, or the so-called reduction of violence, worked really well for that week. We had a week of almost no major attack, very tiny, small attacks here and there. And what we have seen in the following week was 2,417 attacks by Taliban, right following the RIV week. And on daily basis since then, according to one of our leading TV channels, Tolo News, on daily basis, there are 50 attacks by Taliban and 9 by government initiated. So unfortunately, as we see, probably Afghanistan is one of the few countries around the world where the warring factions, particularly the main side of the conflict, despite coming to a sort of agreement with one of the major parties to conflict, to make a peace or make a deal about something like peace, there is no a genuine and honest commitment to stop civilian casualties. Only a week and a little more before we saw a tragic attack by towards one of our very small, tiny minorities, religious minorities. The Sikhs in temple got attacked, and a lot of people were killed. So we are faced here with a kind of an enemy to humanity. That's COVID or non-COVID, deal or non-deal. The civilians are being targeted regardless. The claims are not important who takes the claim. We know who has monopoly over violence, over suicide attacks, coordinated attacks, and all the initiatives. And there is a really serious need for a call for a humanitarian-based ceasefire. Now, in terms of the approaches to the COVID-19, I come back to it. From what I observed, and as a researcher and as somebody leading an organization mainly focusing on socioeconomic impacts and also on the governance side of it, my observation was that from the very early days, the government response has focused more on the worst case scenario. And it's probably a little bit under the influence of the international, major countries, how they were preparing to build hospitals. There was suddenly a story about, building a hospital in Herat, which was problematic because for fighting COVID, you don't need hospitals. You can turn a school, a mosque, a local, community elders or leaders' house to a hospital. What you need is specific awareness to prevent it in the first place. So our focuses were a little bit chaotic, I would say, in terms of the responses. It's to me as an observer, it's a little bit became more about propaganda than actual actions. Although I'm saying that propaganda because the social media show off of politicians visiting the COVID-19 affected hospitals make it quite problematic to me because we have too many politicians. If everyone starts going and looking at the treatment and how it is, it becomes another issue for the patients and also for the actual medical practitioners to do their job. There were reports of some powerful people trying to abuse their force, like in every other issue, also to force themselves to do tests, to use the test. As we all know around the world, the testing is a major issue in any country. So Afghanistan is not unique to that. So unfortunately, that irresponsibility by some of our powerful people also caused some issues because we may have run out of the testing kits in some areas. And most importantly, in most of the across the country, there are no testing facilities. There are only in Kabul and maybe in a few other places. So it takes time until the samples arrive to the testing center and the results goes. In many cases, it happens that by the time the results goes back to the families and to the province, the person passed away and already spread the virus to the family, to the extended. As we all know, Afghanistan got majorly affected to COVID-19 cases through its western border with Iran. A lot of returnees, we have daily returnees from Iran arriving, and they arrived bringing the virus with them across the country. People who return from Iran are not coming and settled in the cities. They go to the remote areas. They go to the faraway areas. In a very initial time, I remember a case from Ghor province where out of 3 people who were affected, the report came to us saying that, oh, one died and another one is in a very critical condition and the family is trying to take them to Pakistan. So this is the usual practice because of the lack of medical facilities. So the awareness level was worryingly low. Now, another challenge to the awareness level is also, unfortunately, the negative role, I would say, that some of our religious leaders are playing. This last Friday, the first Friday of Ramadan, unfortunately, we had a very major prayer ceremony congregation in Herat province, one of the provinces worst hit by the COVID-19. Of course, prayers is a very important obligation to the Muslims, but we understand that the global Muslim leaders decided to rethink the arrangement for this year because of this fear of spreading the virus. And in other cases, also religious leaders have not tried to acknowledge this as a major issue, which requires a very important attention. Now, how to sort of link another sort of point before I just link COVID-19 with the peace process. I think in terms of the government responses overall, a major attention was mostly towards, the worst case scenarios, preparing the hospitals and centers. Awareness raising, there were activities and attempts, but not really much context specified, as I would say. In my opinion, based on the research that we're doing, I mean, we've been doing across the years, what we see is critical is to involve everyone and taking and sharing the responsibility. It's not the responsibility of the central government and the top leadership to take care of everything. We have a very large community of NGOs as aid workers in Afghanistan who have contributed to governance system in the country. We have a nationwide coverage through Citizens Charter program, which is a World Bank large program covering all across the country through the CDCs, the local level, the local community development council levels. And these are basically the key sort of circles of local communities to take the responsibility at the very sort of local level to fight COVID and find solutions, particularly in terms of, the new arrivals to the community with the symptoms, basic symptoms, and try to isolate them, for example, self-isolation and all these, nicely explained things in the Western or in the global context are nice, but they don't make any sense to an average Afghan family living in one room, more than 5-6 people, or even more than that in some cases, due to poverty, due to lack of space and all of that. So those kind of isolation arrangements could have been, better to take in. And also in the urban settings, we have local mahalla or guzar leaders, wakil guzar we call them. So it would have been much better to put a lot of responsibilities on those type of people who could actually take the lead in terms of observing who comes in and who goes out and who has symptoms. The lack of awareness and the level of understanding the dangers of COVID-19 has also created a sort of a stigma where people are running away or people are trying to skip getting into the hospital, admitting to the hospital. So I don't have a specific, sort of evidence-based for claiming this, but there are concerns among the NGO communities who are also delivering a lot of development aid services that they have been relatively sidelined in the process of responding to the COVID. I mean, everyone is doing their bits, but coordination between different, private sector NGOs, media, government is not seeming to be there at this stage. I hope it gets better if attempts have started. Now, how this is looking like in terms of the relation with peace, as I started my remarks by giving you a picture in terms of numbers of how many people we are losing, unfortunately, due to the violence and the ongoing violent conflict. Unfortunately, we see no signs from majorly from the Taliban, based on the numbers, to surrender or to accept a ceasefire on the ground of humanitarian need. This is because it's very difficult for a group that's used specifically over the last 19 years terrorism and terror and fearing people and blowing people up as their main source or resource of basically making themselves relevant to the processes. It's very difficult for them to accept that they have to have some respects for humanitarian principles. They use humanitarian principles. We all know it. They use it by highlighting the night raids and house raids, which I personally believe it's important to acknowledge that that's also a grave violation of human rights. We know that grave violations of human rights and humanitarian principles have happened by government side as well, by our ANDSF or our international partners. But that doesn't sort of mean that the other side is so innocent and they are just, these peacemakers, that they have some political prisoners in prison and they are at risk. In prison, everyone is at risk. By the way, women are also at risk, who are in prison not because they have blown themselves up or not because of basically, committing major crimes, but just because they have run away from violent families and they end up in prison. And now they are also at a very high risk of, COVID-19. So, what becomes really complicated here is for Afghanistan to be faced by this form of armed opposition or armed faction who has difficulties in understanding basic principles of humanitarianism. And the only way out of this probably would be to really talk to those who are providing them safe sanctuaries, those who are providing them financial assistance, and those among the Muslim world. Just to add on the calls for ceasefire that Ambassador Kobia has made, OIC, Organization of Islamic Conferences, have also made this call on urgency of humanitarian grounded ceasefire. But is there a history of Taliban listening to the Islamic world, if not to the so-called non-Islamic world? Unfortunately, the evidence is against that. I mean, they are not. They are pretending to be the very true, genuine Muslims, but every action they have taken over the past 19 years is not justified on any basis to prove that they are more Muslim than any average Afghan that they have been killing and they continue to kill. So to sort of come up with the one additional point, and then how a humanitarian ceasefire will look like Marika, you were asking me this question. One other challenge, and I'm saying this, leading AREU and, facing with lots of issues in terms of data gathering, is the problem with data in analysis. So we talked about, casualties, civilian casualties. We talked about numbers in terms of, COVID-19, people who are positive cases and those who are reported to be recovered or who reported to be dead. Unfortunately, we also have to acknowledge and note that these numbers that we share are not completely accurate. Because we are not, although I know that Ministry of Public Health has been really active in terms of, creating, networks and WhatsApp groups to the district level hospitals by basically demanding their health practitioners to gather data. There are WhatsApp groups, or organized across the country. But we all know that a lot of cases are not reported. So the data cannot be sort of entirely accurate in terms of, the number of recovered or the number of deaths, particularly because in a country like Afghanistan, health issues, fever, pneumonia, and all these things, which are very similar symptoms like COVID-19, can kill people very easily, from very young and newborn to the elderlies. And we had a very, very large number of elderlies losing their lives this year as well. No one knows the reason, but it could be linked to what we are talking about and what we are facing globally. So finally, how is there a feasibility? Is there a chance? There definitely is a chance. A week before signing of the deal, I call it the peace, so-called peace deal between the US and the Taliban, we've witnessed there was reduction in violence, so-called. They like to call it that, and it was ceasefire. We can call it reduction in violence, but can we stop the ongoing war? We saw that it worked. So if there is an agreement, there is a possibility. I'm sort of positive that if the main center of command for all the violence that they are causing, from suicide attacks to attacks at the village and rural areas. By the way, this spike following the US deal is more in the rural communities in Afghanistan. Districts and local police headquarters have been attacked, and we had dozens and scores of people being killed. And who are they? At the end, Afghans, ordinary Afghan army officers. From one side, if Afghan security forces are killing the Taliban, the local ground forces of Taliban are also Afghans, and they both cause disasters as we head for future, because both cause loss of young Afghans who are breadwinners of their families. They leave orphans, they leave widows, they leave parents without any help and assistance. So the feasibility for a ceasefire is there. We have experienced that during the Eid some years ago. It worked very well. We have also relatively witnessed that such a possibility is also feasible just before the week before the US peace deal. So if that is feasibility exists there, the only means and source is to mobilize probably Qatar, the country that hosts them, to pressurize the political leadership settled in Qatar to make something about it, and also those countries who are known for supporting the Taliban to stop it, because history is witness to this situation, which is unprecedented in our lifetimes, in these generations, and it's something that requires everyone's responsible attention. From we are grateful to see the EU is supporting the humanitarian basis for ceasefire, and the UN has made the call. Of course, Afghans were first to sort of push this call and make Afghanistan's conflict also included in the global call for ceasefires. So we have to all take action by the levels that we can to make this a reality. Thank you.
Thank you, Orzala, and thank you for reminding also us about just the very real costs the war is taking on Afghan civilians, and the insurmountable challenges they're facing just to live with basic human security. I am encouraged that you think that the feasibility of having one is there. In terms of at least the Taliban, we understand that they can reduce violence. It's just whether or not there's a will to do so, and there's enough pressure exerted on them to do so. I'd like to now turn to Sahar Halaimzai, who launched a ceasefire campaign in Afghanistan, to tell us a little bit about the campaign and also what you're hearing from the humanitarian aid organizations and from civil society more broadly.
Thank you, Marika, and Ramadan Mubarak to everybody who's observing. I'd like to thank all the panelists for finding the time to have this discussion, which I think is a really important one. As Marika mentioned, I'm a co-founder of a campaign called Time for Real Peace. We launched last year in response to the announcement of the peace talks with the Taliban. And last month, in response to the kind of hugely worrying picture that was emerging from Afghanistan in the context of COVID-19, we launched a campaign calling for a humanitarian ceasefire to allow the country to actually deal with the major consequences of this pandemic. And our campaign has been supported by over 90 organizations worldwide, dozens of grassroots groups in Afghanistan, as well as major organizations such as Oxfam and Norwegian Refugee Council. We've seen COVID-19 really take its toll on some of the wealthiest countries in the world. Afghanistan is one of the poorest countries in the world, with a hugely precarious and weak public healthcare system. And the country doesn't really have the capacity to do tests on any real scale. Just to put that a little bit in context, there is one facility in the entire country that does diagnostic tests for COVID-19, and its maximum capacity is about 50 tests a day. And of course, as Dr. Orzala mentioned, there are hundreds of thousands of migrant workers and refugees returning from Pakistan and Iran, which has been one of the epicenters of the disease. And now there are confirmed cases of COVID in 30 provinces around across the country. And of course, this is happening against the backdrop of increasing violence by the Taliban. Andrew sort of touched on this a little bit. In the last 6 weeks, the Taliban have ramped up their attacks, killing hundreds of security forces and civilians. In fact, according to official reports, in the last 2 weeks, they've been carrying out between 50 to 70 attacks a day, killing between 25 to 40 Afghan security forces. And again, as Dr. Orzala mentioned, that these are just ordinary Afghans for a lot of the time. And even though a spring offensive hasn't been officially announced, it looks like it's very much underway. And they have rejected a call for a humanitarian ceasefire. And the reason we're pushing for a humanitarian ceasefire, aside from the obvious challenges of dealing with something like COVID, in a place like Afghanistan, against the backdrop of this kind of conflict, it hugely limits other actors, not just government, but other actors who can support the response to COVID. Humanitarian organizations need to be able to ensure the safety of their staff. Civil society activists and groups can play a significant role in a public health crisis like this. We've seen civil society mobilize already in Afghanistan to try and support some of this response. Activists have been handing out leaflets to drivers in Kabul, explaining how the infection is spread. Others have been circulating in public spaces in different cities and provinces in protective gear to talk to people about what measures they can take in order to protect themselves. And again, these activities are hugely limited because of the security situation, because of this kind of increasing violence that we're seeing. And civil society can play a really big role, like I said, and there is, we have evidence for this. In the 2014 Ebola crisis, the government of Liberia found that citizens didn't really trust the state, and that their sort of mass media public information campaign had largely failed. And so they identified intermediaries in local communities and villages who then went and knocked door to door and spoke to the locals about how to how to protect themselves as much as possible against the Ebola. And a post-outbreak survey found that citizens in those communities were 26% more likely to allow the government to bury the deceased, and 15% more likely to actually support general disease control measures. So in a place like Afghanistan, we really need that. But again, that's hugely limited and problematic because of this sort of ramping up in violence that we're seeing from the Taliban. And the kind of last final point I'd like to make is talking to civil society activists and humanitarian actors in Afghanistan. One of the things that seems quite alarming and problematic is the way in which calls for a humanitarian ceasefire are framed within the context of the peace process. It took over a year to get a deal between the US and the Taliban that covered withdrawal and counter-terror measures, and one that didn't really move the needle on some other really huge issues, like a ceasefire, like intra-Afghan talks. And the Afghan people really don't have the luxury of time for there to be a political settlement. What we need to focus on is a humanitarian ceasefire outside of that. And I think it's particularly worrying seeing some of the experts and mediators in this space also framing it in that way, particularly when they know better than anybody that a peace process takes a long time. It has a lot of stops and starts. You have to recalibrate constantly. You have to renegotiate. And the Afghan people deserve better than waiting to see elites trading cabinet posts before there's a joined up response to this infection. Because what they're looking at, the reality for the majority of Afghans on the ground, is that they're looking at tens of thousands of people losing their lives as a result of this pandemic.
Thank you, Sahar. We'll turn to some of the questions. But I wanted to pose a question to everyone. Where are the levers for pressure to push for a humanitarian ceasefire? Orzala, you had mentioned Qatar potentially as a source, though we also understand that they're caught up in the Gulf crisis and are pleasing, and basically are following the American approach. There has been sort of tepid calls by the Emir and as well as the Americans to push for a ceasefire, as Sahar said, almost couched underneath the peace process. But is there another way to, presumably I also understand that, there were attempts by people to reach out to the Taliban to get them to understand the gravity of the situation, at least to freeze the conflict. Of course, we know that ceasefires are a risk for everyone. They're a risk for the Taliban, feeling that they might lose control over their fighters, but they're also a risk for the government, where the Taliban can consolidate and move soldiers to other areas and so forth. So I guess my larger question is, to those who can answer this, is where are the real levers? It's that, we have Sahar building sort of public pressure. There's been continuous public pressure from Afghan civil society, and it's not as if we can't hear them. Maybe we're just not listening to them, and we should be honest about that. So are there any other areas, any other levers that we can use to really push for a ceasefire before the COVID spreads?
Marika,
Andrew.
do you mind if I jump in? Yeah. I think what we see with the deal that the Taliban have secured with the United States is currently both a challenge but also an opportunity when it comes to trying to reach a de-escalation of violence, whether that's officially called a humanitarian ceasefire or whether we're really talking about bringing the violence down to be able to respond more effectively. Currently, no matter how much human suffering takes place, no matter what the catastrophe that COVID-19 might bring to Afghanistan's population, the Taliban have clearly decided that suffering is a price they are willing to accept because of what they fear from a ceasefire, because of what they fear in terms of their position in future intra-Afghan negotiations. But what they have also signaled is that what they hope to gain from the US Taliban deal is more valuable to them than anything they could win in the goodwill from the Afghan people. Ambassador Kobia mentioned how all players in this conflict should think about what the Afghan people will think about them in the future. And the Taliban have clearly decided that the potential gains that might come from their agreement with the US are more important and more valuable. To be able to to force the United States out and to claim their victory, as they call it, in this way. The problem is, if the Americans are offering big promises that seem like a fulfillment of all Taliban objectives, and a ceasefire is a later step in that process, why would the Taliban set all of those potential rewards aside and move immediately to a ceasefire that was an arrangement of this promising deal? But what that also means is this deal and moving it forward is very important to the Taliban. And the United States has not always been able to pressure the Taliban, other than through the use of its own military force. But today, the Taliban's reluctance to engage in a humanitarian ceasefire, and by its own public statements, wanting to follow the letter of the law, as the ambassador mentioned, really wanting every letter of the US agreement to be followed before they discuss a ceasefire, that shows how important that agreement is to them. And so I think for the first time in a long time, the US has political leverage. And as you noted, high-level US figures have visited Doha, and I do think there is a new opportunity for pressure there.
Okay.
Yes, please.
Okay. Unless there's a lady who wants to come in.
Go ahead, Ambassador. I'll just talk after you.
No, please go ahead if you wish.
That's fine.
Please.
So, thank you. So, in just to follow on what Andrew was mentioning, I noticed Ambassador Khalilzad's tweets from yesterday. Ambassador Khalilzad is not sort of using his own leverage, his own position as a leverage to force or to push towards a humanitarian base. He says, oh, I support the call of OIC, I support this and that. I did not see a very clear, I hope I'm wrong, but so far my sense is that the US, through Ambassador Khalilzad at least, did not give a very articulated, message about the urgency of a humanitarian grounded ceasefire. The deal is important for them because, look, the deal is a set of promises made in the absence of the Afghan state, basically to give them all kind of things that they're asking for. I heard through the media that one demand that they have is to get release some of the people that were arrested who were directly involved either in masterminding or in facilitating and leading one of the deadliest attacks in Kabul, in Afghanistan. Series of deadliest attacks, like the famous German embassy, Zambak Square attack, the person who's behind that. So, like, on what basis are we going to agree on that? Is there any role here for ICC to play? Like we had just a request for the call, which government is trying to sort of delay for the moment. There has to be some basic rules here, and the rules were not respected during the deal signing. I personally believe the deal itself was a positive step if it results into an actual peace. But if you ask me, does it? I don't have a yes answer for that, unfortunately. Like seeing what is happening right now, witnessing actually an attack on the most vulnerable and most innocent communities in the country in the last 2 weeks ago that happened. Why would somebody in the middle of this crisis, a humanitarian crisis, go and attack in Shor Bazar, the center of old Kabul, a temple of Afghan Sikhs? Are they a threat to national security? Are they a threat to Islam? Are they a threat to anything? Nothing. It's just to pressurize, to humiliate us one by one, to humiliate any effort Afghanistan is making towards reconstruction and good governance or anything. Challenges are there. We all agree. So, back to the point, I think US definitely has a huge leverage, and so far they have been very conservative, in my opinion, and using that. Pakistan is another country, and let me be very frank and clear here, at least based on my own understanding. I don't expect Pakistan to be the main sort of leverage holder here, but they do play a role. We all know, let's be very frank about it. We all know that they have a role to play. I was on another Zoom call facilitated by a Pakistan think tank a couple of days ago, and I made that call very clear. I called on the Pakistani civil society, traditional or more sort of modern civil society, both, to mobilize and to ask for it, because any humanitarian disaster happening in Afghanistan, like any other disaster, it is going to affect Pakistan as well. So I think the call is for basically anyone who is providing or facilitating, safe sanctuaries, financial assistance, and all of it, to pressurize the group.
If I may just add 1 or 2 points.
Except if they will.
Please, Ambassador.
No, thank you. No, to answer your question on the levers, well, I tend to prefer to convince rather than use coercive levers. But let me try to share a number of levers that we may have. The first one is, let's go to the fundamentals. This whole process has started with a 4-point package. That's what both parties agreed on. And this 4-point package was withdrawal versus terrorism and ceasefire versus intra-Afghan negotiations. And these 4 points, were, at least at the beginning, and as far as we knew during the negotiations, at the same level. Now there has been two points which have been given a more prominent role, but the ceasefire was always there. It's nothing new. And some try to put it as a new element that we are trying to add. It is not the case. It has always been there from the very outset. And Ambassador Khalilzad was always very clear that nothing is agreed until everything is agreed. And these are the 4 points of the package. And the issue of prisoners came later. Or at least the prominence of the release of prisoners, came later and became a condition sine qua non, an ex ante condition, when it was not supposed to be. So that's the first point. My second point is clearly the emergency and the urgency. As I said, we cannot pretend that this world is the same as it was 2 months ago. It is not. So there are populations to protect, there are people to protect. We're talking about a pandemic that may call more lives than the war. So if people, if leaders, whatever they are, from across the country are not able to put their acts together and mobilize national efforts in order to fight this pandemic, well, then there is a problem. The third point is, I think the more unified the international message, the better. The EU position, we want this to be as much as it is possible an Afghan thing. Afghans need to decide. But if the international community can help, it is certainly on the ceasefire and calling for a ceasefire. So I think you need a unified, a joint call for a ceasefire following the UN call. And all the neighbors should call for that and beyond the neighbors. And there are a number of countries which have not expressed themselves unambiguously on this. And I think there's a responsibility there. My fourth point is again, the political positioning. If the Taliban want to get to power one day, go back to power, participate in power, share power, again, not for me to say, for Afghans. But there's a political responsibility, and we cannot say, oh, now I behave as I wish, and later I will behave, in a way that, enables me to get a better profile on the political scene. I think what is happening now in refusing the UN call is putting oneself outside the Council of Nations. I very often hear from the Taliban, and it is a good thing that they want to normalize relationship with the whole world in the future. This is good. If this is an ambition, well, then you need to behave in a way that will enable you to participate in the concert of nations. Afghanistan is a member of the UN Charter. There's a continuity in international obligations. The UN has called all its members to call for a ceasefire. Afghanistan is a member. So be part of the concert of nations and position yourselves as politicians and not as insurgents anymore.
Oh, am I muted? Thank you, Ambassador. We're going to have to wrap up this event. And on behalf of the South Asian Center, we thank you for tuning in to watch this discussion. We could have gone, I have a number of more questions I could have asked, but we don't have time. But for more content and literature on this topic, please, and on the South Asia region more generally, please visit the Atlantic Council South Asia Center website. And I hope we can take forward some of the ideas, at least to put pressure on some of the ideas that you mentioned on how to sort of move the needle on a humanitarian ceasefire before it becomes too late. Thank you.
Thank you.
Thank you. Thank you very much.
Thank you, everyone.